Okay, the second demonstration is going to be for the second assignment where you have to put two beams on to the contour that I gave you. So we use the same contour we use for the shift technique, this one. And I have my contour here, and I'm going to decide again where I want my beams to intersect. I'm going to call that the central axis. That's where we're going to put the isocenter. I've identified it just by putting a dot there and then extending the lines there, making an X. So whatever beams I put on need to go through this X. So since this tumor is here on the right side of the head, I'm going to try to put one beam through the AP and the other beam through the right lateral. So as previously shown, I'm going to line up my central axis on my isodose chart, put the T at the beginning of tissue. I'm not going to use line shift correction on this one. If I were doing this for real, like manual treatment planning, I would have to shift these lines as I showed you before and have that represent the AP beam. And then I'm going to put my second beam on. Again, this is the central axis, so I have to make sure the central axis lines up with the central axis on the isodose chart. Put my T at the beginning of tissue, and then I'm going to trace that beam. Okay, so now the first step then in this would have been to trace the AP beam on. And so after that, this is what that would look like. AP beam is on. The second step would have been to add the lateral beam. I've added the lateral beam. Now I've done that in a different color because it's going to make it easier for us to discern between beams, decipher the right lateral from the AP beam isodose lines. I used a different color, so all of the black lines you see are the AP beam, all of the red lines you see then would be for the lateral. The next step then would be to add dose lines, because what is actually happening is you're seeing an accumulation of dose. So for example, here where the red line crosses the black line, this red line represents 5%, that black line represents 5%. So at this point, that intersecting point, this represents 10%. Okay, so we could follow the 5% line up, over, and across the black lines and start adding doses. I only represented a few dose points in here. I want you to do this, the rest of it on your own. But so for example, this would represent 10%. This point right here would be 15% because the 5% of the red is crossing the 10% of the black. Over here, for example, this would represent 85%. That's because the 5% from the red is crossing or intersecting the 80% dose line from the black. That's 85%. And I found some points over here that are 90%. There's an 85% there. I've gone over in this corner and found all of the intersecting points and found 10%, 15%, 45%, 60%. Over in here, in this area, you see higher dose line points. For example, here, there's 140%, there's 140%, there's 140%, another 140, another 140, 150, there are 130% out here, 120%, 110%, and so on. So it'll be your job then to start by looking to see where the beam lines intersect each other and then adding those doses and using a very sharp pencil then writing down the additive dose. Then we're going to have to see if any of the dose lines that we've added connect to each other. So for example, here's a point of 140, 140, 140, 140, 140, 140. Almost seems like it makes a pattern. But before we do that, we have to decide if these 140s connect, if there's any place where we don't see intersecting points, is there a 140? So right here, for example, between 80 and 90 for the red would be 85. Between 50 and 60 for the black would be 55. 85 and 55 is 140. So there's a 140 there. The same here, between 70 and 80 is 75. for the red between 70 and 60 is 75. There's another 140. Okay, so the 140 connects here. So we're going to do that for each of the additive dose lines that you've seen. So preliminarily, let's see.